this is Sydney Sukenjo, and this is my final project on childhood obesity for Sociology 100. Obesity can be seen in our neighborhoods statewide as well as our country nationwide. Obesity is a growing epidemic affecting the United States and endangers the public health, which starts with our children. Many people wonder, is obesity even a problem? Well, it is. According to Dr. Jeffrey P. Copeland, director of the Centers for Disease Control and Prevention, as a nation, we need to respond as vigorously to this epidemic as we do to as an infectious disease epidemic. Obesity is defined as acquiring excess amounts of body fat measured by the body mass index. Acquiring a BMI of 30% or greater is the percentage at which the average person is considered obese. According to the Center for Disease Control, 14% of adolescents in Hawaii are considered obese. Obesity is a danger to the public health and needs to be responded to immediately because obesity is related to conditions including stroke, heart disease, and type 2 diabetes. Gathering information regarding childhood obesity, there were numerous academic articles and research studies done and performed. I also gathered nutrition facts from fast food chains and looked into child-provided nutrition and exercise regimens in a school environment. The academic articles mainly stated and emphasized the epidemic that childhood obesity is becoming and provide action plans to solve this problem. I have also gathered that fast food restaurants and portion sizes are the primary causes for obesity. What child knows that McDonald's is a mass killer? The United States is the home to over 12,804 McDonald's restaurants, which on their menu have items that obtain a range from 150 to 1,900 calories. One meal consumes half of the calories based off of a healthy 2,500 calorie diet. Schools have also recognized this problem and are shifting to healthier foods and supporting more exercise in a school environment. I identify as a conflict theorist because I believe that the fast food industry plays a major role in childhood obesity. Fast foods not only lack nutritious value, but they are also high calorie and packed with junks, such as fat, sodium, and sugar. I believe that the fast food industry is tricking younger generations to eat their food. For example, McDonald's offering a Happy Meal that comes with a toy. Childhood obesity is also related to sociological ideas such as social movements and social mobility. There are many social movements and initiatives to combat childhood obesity. One example would be 5210 initiative and maybe even Michelle Obama's Get Up and Move initiative. So social mobility is also closely related to childhood obesity because as we all know, it takes money to eat healthy and McDonald's is just so cheap. Poverty really affects the diet of many people. When you need to eat and you only have $1, McDonald's doesn't sound so bad. According to Copeland of the CDC, national efforts are needed to encourage physical activity, better nutrition, and to conduct research to identify effective educational, behavioral, and environmental approaches to control and prevent obesity. Efforts of physical activity and better nutrition in educational environments are already seen within our state, including schools such as Sacred Hearts Academy, which promotes student activities and healthy, nutritious food. I believe that to change, a community effort is needed, starting with the families. Educating families to eat healthier and exercise more will ultimately eliminate obesity. Death due to obesity is 100% preventable. Therefore, as a nation and state, we must do all in our power to prevent this epidemic, starting with our children.